welcome back, everybody. So I will say that when we first came up with the theme for this year of identifying and overcoming the barriers to implementation of the 3 Rs, Megan Lafollette was pretty top of our list, having done her PhD in specifically studying barriers to implementation of rat play at Purdue. She now works at the North American 3 Rs Collaborative as the program director, and she's going to be talking to us this afternoon about how we can implement environmental testing as a way of replacing Sentinel cages in mouse housing.
Awesome. Can someone just confirm that they can hear me and see my slides all right?
Yes, on both.
Okay, good. Always good to check before I barrel ahead. So yeah, I'm so excited to be part of this year's symposium. Change management, creating real world 3 Rs changes is near and dear to my heart. And today I'm going to talk about a really successful example of creating change from the ground up that I've done with my work at the 3 Rs Collaborative. Let me just advance my slides. Awesome. So this is me, Megan Lafollette. So I am executive director at the 3 Rs Collaborative, where I work to advance implementation of the 3 Rs. And as I was introduced, I actually have a PhD in animal behavior and welfare, where I specifically focused on implementation. And that really is my passion, really understanding, are we using certain 3 Rs techniques? Why or why not? And how can we change that? And also in the process, also understanding which 3 Rs techniques are really deserving of implementation. There are some that are further along in that pathway than others. But today I'm really going to talk about specifically environmental health monitoring. So some of you may know that traditionally, when we have rodent colonies, there is often a cage of soiled bedding sentinel rodents that are housed on the same rack. Dirty or soiled bedding is transferred to that cage, and then they're periodically euthanized so that they can be tested and ultimately ensure colony health status. So see if there's any pathogens, if they are, treat them, etc. This has been done for a number of years. But now, with the advent of PCR technology, we've got some other good options. Specifically, we use the term environmental health monitoring as a broad term to really encompass any type of health monitoring without these soil bedding sentinel rodents. And there is now evidence that this is an important, impactful, and practical 3 Rs replacement. But of course, just because we know these things doesn't mean that there's still not barriers to change. I know that there are still people out there as of today, I actually hope you're online right now, that may not be convinced that this is really the right thing to do. They're interested in, is the evidence really there to support this technique before we just replace what we've been using for all this time? Is it going to make an impact? And ultimately, is it really practical in my facility? On the other hand, and I also hope some of you are online today, is there are people that are convinced that they want to make that change, but they're running into roadblocks. Maybe they're extremely busy. They don't have time to develop their own program, or they're trying to convince other people at their institution and they're getting pushback from them. Or maybe they just don't have the training. It is a new type of way of collecting this data. And so it is important to actually get that. So my nonprofit, the 3 Rs Collaborative, was really created by professionals in the field who understand these challenges firsthand. And that's why our mission is to advance better science for both people and animals. And we do this through facilitating collaborative 3 Rs efforts. And we really put science first as really the most important thing that we're trying to change, is just have better scientific practices. And we believe that with better scientific practices, it will also be better for the people and the animals. So we are truly collaborative. It's a key part of our name and a key part of our mission. This is a picture of just our leadership team and our board of directors, as well as their institutional logos. And I hope that you can appreciate that it really does span across academia, industry, government, other nonprofits, consultants, and more. And we actually work with individuals from over 150 different institutions across the United States, Canada, and Europe. We really have 3 key goals when we operate. First is to promote the 3 Rs broadly as a concept. We want to create a research landscape that knows what the 3 Rs is and is supportive of them. And not just in, oh yeah, we support these as a concept, but we're supportive of applying them at scale. Second, we want to promote specific 3R strategies that we've identified and advancing their implementation of these strategies that are high impact, evidence-based, and practical. And third, of course, as any organization, we also want to promote our own organization. We know that there's many people out there that don't know about us and all of our resources. And so the more that we can get the word out about us, the better. To promote the 3 Rs broadly, we have 3 core strategic aims. First is we're creating a 3R certificate course to provide really broad, accessible, wide-scale training to many different types of institutions and stakeholders. We should be releasing this in the next couple months. It'll be virtual, about 5 hours long. It will be a paid opportunity, kind of similar to city training, but hopefully a lot more engaging if you're familiar with what city training is. The next is to promote culture of care through our Compassion Fatigue Resiliency program, which is soon to be expanded. We have materials to help institutions set up their own institutional compassion fatigue resiliency programs. Those are all freely available online, and we have a lot of resources in that area. Third is we give presentations just like this and others at conferences and generally provide resources. To promote specific higher impact 3R strategies, we work first, again, I've emphasized this, to choose the right topics. So what is really worthy of our attention, and the right working groups, stakeholders that come from different parts of the industry to help lead those efforts. Then we work to understand the status quo. We often conduct longitudinal benchmarking and attitude surveys, and we host discussions with stakeholders. And then, critically as part of our strategy, is we've worked to accelerate implementation by creating things like resources, so actually having downloadable SOPs, technology hubs, demonstrating social proof by actually having logos of institutions that have switched, and addressing any misconceptions or operational challenges. And I'll actually, today is going to be a really good case study of how we've done this really well. Again, I want to emphasize that when we're choosing these initiatives, we really look for things that have strong scientific evidence. Systematic literature reviews that were discussed earlier are always wonderful for this, are going to make a big impact in the field, and are practical in the real world. There's some things that we know would make a big difference, and maybe one day we can get there, but if they're so far down the pipeline, we want to focus on the things that are really at the cusp and we can make big impact quickly. So I'm going to be talking about environmental health monitoring. Actually, our current president, Dr. Elizabeth Nunemaker, is going to be talking broadly about 3Rs change. I know she's going to be talking some about our refined mouse handling work, both within our organization and her organization next. But we also work on translational digital biomarkers, microphysiological systems that Lorna just talked about, and we're also going to be launching an in silico initiative as well. But that's enough about us generally. That's kind of our core concepts, how we operate as an organization. Let's really dive into the topic of environmental health monitoring. So first of all, quick note on terminology. Again, this soil bedding sentinels, this is that traditional sentinel that are live mice used in cages. Environmental health monitoring is any other type of health monitoring that doesn't require the use of those live animals. And there are 2 main types that are used as primary strategies. First is exhaust dust testing. This involves swabbing the plenums of racks. So this is where you have a cage of racks, and at the end, the plenums come out. You can swab that, or you can have inline media. And this really only works for 2 types of cages, Technoplast and Allentown, but it works really well for them. Lots of other terms for this. Exhaust dust testing is vendor independent terminology. The second is sentinel-free soil bedding. This works with any types of caging and is extremely similar to that traditional health monitoring work, but instead of having live mice in that extra cage, you have a swab or a media, something to collect that PCR and then send it out for testing, or collect the DNA and then send it out for PCR testing. And the bin or cage doesn't have to be on the rack, but it can. There's also some supplemental testing. So often people do research and equipment monitoring, and direct colony sampling can be a really good option as well, again, as supplement or for smaller colonies. So a presenter earlier talked about the value of systematic reviews for preclinical research. I am also a big advocate that systematic reviews are really important within the 3Rs field. So not just that preclinical work, but within our field, what are these 3Rs things that we should be focusing on? And lucky for us, there was actually a systematic review done on soil bedding sentinels in 2016. So this traditional sampling type that many of us have used. And actually of that this time, only 15 articles, conference presentations, or posters had been published on the topic of efficacy for soil bedding sentinels. And so with that few of articles, with all the mixed methods, this paper decided that, quote unquote, sufficient evidence for supporting soil bedding sentinels would be if at least 2 or more publications reported at least 1 sentinel was actually infected. This is pretty low barrier to evidence, but it is still there nonetheless. And at this time, there was actually only sufficient data to conclude that soil bedding sentinels were effective for 5 pathogens. They're listed on here, and many veterinarians that actually work on their health monitoring programs will tell you that sentinels are not, in fact, reliable when it comes to detecting fur mites. So only 5 pathogens for soil bedding sentinels in 2016. This review also concluded that soil bedding sentinels don't work for Sendai virus, and that there was simply insufficient data to determine if they're sufficient for these remaining pathogens. Now, this article was really helpful because it kind of gave us that baseline data for sentinels and allowed us to kind of have a template in comparison for our systematic review. We decided that we wanted to conduct our own systematic review for environmental health monitoring. And so we wanted to answer a couple questions. So is there really evidence to show that environmental health monitoring works? If so, for what pathogens? If so, is it only for exhaust dust testing, or what about sentinel-free soil bedding? And then also we want to know, is it better than the current status quo? So again, this systematic literature review was excellent for really establishing that evidence base behind environmental health monitoring. And I'll let you know that this systematic review is being drafted right now, so it has not been published. It should be done in the next couple months. Again, we wanted to kind of provide that overview of the literature. With any systematic review, we really wanted to have high rigor and objectivity. Certainly as a 3Rs organization, we want to show that, we can replace these technologies, but we wanted to ensure we didn't have bias throughout. So we made sure to follow PRISMA guidelines as well as CIRCLE guidelines. We searched 3 databases to identify the articles to include, and we actually had a higher standard. We didn't include conference abstracts. We only reviewed peer-reviewed articles. They did need to be in English, focused on rats or mice, and then we used these types of health, these terms to actually find them. And the other thing to note is that we actually had 20% of those coded by a separate reviewer to ensure there was concordance and that we weren't, again, biasing our sample. For each article, we looked at sampling type. So which type of sampling were they actually looking at? Not all of them looked at soil bedding sentinels and environmental health monitoring side by side. We also looked at the types of pathogens. We actually, we coded every single pathogen. There were so many of them that we couldn't necessarily look at statistical analysis. So we also put them into categories. So looking at bacterial or fungal agents, parasites, or viruses. as well as we also coded them by quote unquote importance. So there was a paper published by Philasa about basically what should be on your health monitoring panels. Some types of pathogens they recommend to do 3 months, some annual, and some they don't include. We know we have them, they're opportunistic, they don't seem to be causing a big issue. And so we distinguished between those because really we're concerned with what are the pathogens that we can control and actually impact research outcomes. The next thing that we looked at is, did the sampling type in question actually detect the pathogen? Again, we used a similar weight of evidence to this last systematic review, is they didn't have to detect the pathogen 100% of the time in every single sentinel in 100, all cages or all instances, but they needed to detect it at least some. And the advantage of coding in this way is that it did allow us to run statistical models to determine detection rate. So we analyzed our data with both descriptive statistics and mixed linear logistic regression. So our dependent variable was just, did they detect, yes or no? And our independent variable looks at sampling type, pathogen type, as well as their interaction. And I do want to throw out a really big thank you to both Caroline Starlett-Clement and Joe Garner at Stanford University. Joe Garner helped supervise this project, run the statistics, really help with the design, etc. Still helping with writing. We've got a meeting after this. And Caroline Starlett-Clement is an undergraduate who really helped collecting all the data and is helping us kind of work through the manuscript as well. And also my entire environmental health monitoring team has been very helpful because I am not a vet. I did not know about these pathogens before, and they really helped us to determine how to code the pathogens, gave advice on what was important, etc. So, for our preliminary results, we actually had a total of 32 papers included. So that's more than twice as, or that is twice as many as for soil bedding sentinels in 2016. They did look at a variety of different caging types. So a lot did use Allentown and Technoplast, which are really good for exhaust dust testing, but they looked at other things as well. Used lots of different types of mice that when they did look at sentinels, different sexes of mice. Sometimes it wasn't even really clear what sexes of mice the sentinels were. So not necessarily a lot of similarity between the studies, but we still captured this data. And encouragingly, we did find that many of them looked at different types of environmental health monitoring. So of course, some looked directly in comparison to the soil bedding sentinels, but some just looked at environmental health monitoring. And though, of course, most of them looked at exhaust dust testing, this technology was really developed quite a bit earlier than sentinel-free soil bedding. We're still seeing a number of articles already coming out to support sentinel-free soil bedding. Others looked at direct colony sampling and otherwise. And excitingly, based on our data analysis, environmental health monitoring is clearly superior to soil bedding sentinels. And this means, and what I mean by this is that it detects pathogens more often than soil bedding sentinels. And this is regardless of its sampling method, the pathogen type, or the pathogen importance. So I'm going to show you this graph. On the x-axis is the type of sampling, soil bedding sentinels, exhaust dust testing, sentinel-free soil bedding, direct colony sampling. Y-axis is the detection rate. And what you can see is there's a clear and significant difference between the two. 96% detection for environmental health monitoring and only 76% detection for soil bedding sentinels. This is not just statistically significant, I would say this is clinically significant. On the other hand, if we just look across pathogens, there's some differences here, but they're not significant. We're detecting the bacteria and fungi slightly less often than the viruses, but still above 80%. And there wasn't an interaction between sampling and pathogen type. And same if we code the pathogens by importance. This was a separate statistical model, but same results. Really, it doesn't matter if they are the ones we do truly care about or not. So ultimately, I wanted to look at not just the statistical models, but I know it's often really helpful for people to just look at those descriptive statistics. You know, did the article show that it detected or not? So these are graphs where the x-axis is just the number of articles with the finding. Y-axis is the pathogens. This dark blue color is exhaust dust testing was effective based on the article. Gray is it's ineffective. You can see overwhelmingly there's a lot of articles for a lot of different pathogens. Here's a number more. Again, not all pathogens have been evaluated in a lot of articles, but many of them have been evaluated in at least 2. And same for sentinel-free soil bedding. And really the big takeaway here is we already have better evidence for sentinel-free soil bedding now in 2023 than we had for soil bedding sentinels back in 2016. Remember in 2016, that systematic review only concluded that there was only evidence for soil bedding sentinels for 5 pathogens at that time. And yet we still were using it and trusting it for our colony health status. So this is really good evidence to change. Furthermore, there was a number of pathogens that were just only evaluated in a single article. All but 1 were detected. And then the other really important thing is that in these papers, exhaust dust testing and sentinel-free soil bedding were able to detect 13 pathogens when soil bedding sentinels failed. So again, it is more effective than these soil bedding sentinels. Now, it's amazing when there is this kind of weight of the evidence, but there's other things to consider. So first of all is just the 3 R's principles. We find that a number of institutions, you know, just from these articles are saving over 6,000 rodents every year just by switching to these methods. And not only that, they're actually identifying cost savings. It's always extra wonderful and extra convincing when the 3 R's change you're looking at is not just supported by the scientific evidence, but it's also supported by your budget. That makes it a little bit more practical, a little bit easier to get more people on board. Now, of course, there's always limitations and cautions from every research. One thing to note is that environmental health monitoring is so effective that sometimes we've heard from institutions who detect false positives. The old DNA that's still on the rack that has just been sitting there, but the colony animals themselves are not actually infected. And so we recommend that if you do find something that you weren't expecting or just seems odd, to discuss with your diagnostic lab, and then also just be sure that you're really washing those racks really, really well. And of course, for some pathogens, there's maybe not an article directly looking at them, but again, the weight of the evidence is really strong. And then just to point out, they might not be perfect. They might not get everything 100% of the time, although most of the time when we hear from institutions, it really seems they are. But certainly our current method is not perfect either, and it's a lot less perfect. So that's kind of the story behind the evidence of environmental health monitoring. Now I want to talk a little bit about our work to benchmark its prevalence, as well as understand where the barriers are to implementation. So I'm going to talk about, we're trying to understand, all this evidence is there, although I'll say that we've got this systematic review evidence now, and that's really been coming out in the past couple of years. And we wanted to look over time, how common is it, are people using it, why? I will want to note that the baseline results from our year 1 survey are published in JLAS. They were published this January. So if you're really interested in this data, it's all online there. Just keep in mind that the data is like about 2 years old. It takes a little while to kind of process it and get it all online. So like I said, we wanted to understand why or why not this was being implemented. And in my work, there's a lot of different theories of behavioral change that you can use. Some kind of focus more on individual change. Some really think about the wider landscape. I really like this theory of planned behavior. It makes sense and it works and it's replicated. It's very strong. It's been used in a lot of different work. It's really good for understanding change that is happening kind of from the ground up versus from the top down. So basically, how this theory works is we have a behavior. In this case, implementing environmental health monitoring. Now, people don't just randomly start doing this. They have to plan to do this, especially in a large research environment. This is something that they decide to do over time. So although it would be great if we actually measured actual behavior in this and like went into research laboratories and looked at what they were doing, it's usually sufficient to just say, what's your intention for implementing them? And also ask them to report on what they're doing. And what this theory says is that people who think that environmental health monitoring is good are going to be more likely to implement it. If they think that other people want them to do it, other people that are important to them, like professionals, they'll be more likely to do it. And if they actually feel capable of implementing it, so they have control over it, they have self-efficacy, they're confident that they could do the thing, that they will be more likely to implement it. And this work has actually been done. This is what I used in my PhD studies with rat tickling. This theory holds very true, very strongly with rat tickling. You can use it to predict implementation and to kind of help make change. And we're also using this in our refined mouse handling or non-aversive handling that Dr. Liz Nunemaker will talk about in the next talk. So we did actually just wrap up data collection for year 3 this April. We haven't had time to process that data yet. So I'll just be sharing the data from year 1 and year 2 in 2021 and 2022. So we used a mixed methods online survey. Again, it was great to hear in earlier talks, other professionals really saying how important these mixed methods are. It's important to have both this qualitative data where we have open-ended questions. We're trying to understand what people say is most important, but we also want these close-ended questions so that we can run statistical analyses and make broad comparisons. We replicated these instruments from questionnaires when possible and reviewed it extensively. So things we asked about: demographics, methods for routine health monitoring, intentions and beliefs about environmental health monitoring, their familiarity and knowledge about environmental health monitoring, their caging and rack design, and also whether they would accept imports of animals for environmental health monitoring, because we knew anecdotally some people would say, well, I have to export my animals because I have this particular model, I need to be able to share it, etc. And we have to use soil bedding sentinels because we need to be able to export it successfully. So with this, we use thematic analysis, descriptive statistics, and linear regression. So we were able to use the theory of planned behavior to look at, do these main factors, theory of planned behavior, impact intention? And we were also curious to know, like, if people had more accurate knowledge of environmental health monitoring, would they be more likely to implement it? Is it really people, we know that exhaust dust testing is more common. Is your caging and rack design really important? What is really impacting things? For the qualitative data, we use thematic analysis. So basically we ask people, what makes it difficult or impossible for you to implement this 3 R's technique of environmental health monitoring? We take all that data, we read through it multiple times, we develop a manual with codes based on categories, and then we actually assess reliability. So we have a second rater code a random 20% of responses. And so basically what this means is that if I handed you our coding manual and the responses, you would get the same results as we did from this qualitative data. It's a very rigorous way of actually assessing it, but still being able to draw really broad conclusions. So what did we find? So we actually had 52 unique institutions in year 1 and year 2. Obviously, this is a very small portion of institutions across the world, but we still can understand trends, patterns, and barriers from them. Most of them were from the United States. That's our headquarters. That's where we reach most strongly, but we did look at other countries as well. Most of them were academic, which might be the fact that in industry, There tends to be more ordering rodents in. They might have slightly different processes. They might be slightly more hesitant to answer some surveys. It really just depends, but we have a lot of academics in our survey and still a very respectable amount of industry. And then we had a lot of vets as that primary response who were, reporting on their institution. And the vets are typically the ones in charge of the environmental health monitoring program. So this is good. So I'm going to talk a little bit about the descriptive statistics. So this is our benchmarking data, and we just looked at one person from each institution. And what's really encouraging is that even in just 1 year, which in the broad scale of things in terms of institutional change, we saw an increase in people either using only environmental health monitoring or a combination of metrics. Again, we're still not at that 100% that we want to be at, but we're seeing more in that level. And that's what we see as important, is that we're helping make change, even if that change is a little slower than maybe we would like. The other thing that we like to see is actually seeing this combination is good. Not all institutions are going to jump right into doing this right away and completely stop with their environmental health or with their soil bedding sentinels. So even alternating it every quarter and getting familiar with it can be good. And from these institutions in our survey alone, we found that sentinel rodent use decreased by 3,000 annually. But again, clearly more work is needed to increase environmental health monitoring and decrease sentinel numbers. So what are the barriers? This is just our year 2 data. We've presented our year 1 data elsewhere and in the publication. And this we looked at everybody because we know that many different people and often teams of multiple people influence change at their institutions. And what was really interesting with this data set is we actually got many of the same exact responses listed as either a barrier or an advantage, depending on the participant. So in this graph, X is the theme of the response, Y is the percentage of the participants. Blue is that people said, oh yeah, this is really good, this helps me make it, this is an advantage of doing environmental health monitoring. And orange, they actually said, no, this particular thing makes it difficult for me to do. And I'll just point out, of course, replacement very high on the list of advantages for environmental health monitoring. On the other hand, caging and rack type were most often perceived as barriers. So things like IVC rack design, static caging, having lots of caging. And again, this is due to the fact that many early publications were focused only on Allentown and Technoplast racks and exhaust dust testing. But as I talked about in the introduction, we know that we can now use environmental health monitoring with any type of caging, including static or cage level implementation. So that's a very achievable barrier, but one that we need to communicate about. And we needed the research to show how this could be done and how it could be done well. The next was cost. Again, it was actually more people found that as an advantage than a barrier. And we often see people listed as a barrier if they haven't actually run the cost analyses at their institution. And the big thing where costs get cut is in all those animal costs, the cost of ordering animals, the cost of shipping, the cost of maintaining the animals, the cost of just, technician time, caring for sentinel animals, etc. And in a published cost analysis, we find that environmental health monitoring is actually 26% lower than exhaust dust testing. This is a very significant cost savings. Again, although your diagnostic testing is staying the same, this institution was already using PCR, technician time goes down and no animal time. And even for sentinel-free soil bedding, you may not see quite as much cost savings, but even at this institution, they were still seeing a 7% lower cost savings with switching. Accuracy, way more likely to be considered an advantage to environmental health monitoring than a barrier. This is good. This is not necessarily what we saw in year 1. People were still kind of getting on board with that evidence, and we hope that our systematic review will help. Personnel, kind of 50-50. If you have someone at your institution who's really gung-ho, who's championing this technology, that can be a real advantage. And then also your staff are not exposed to allergens. They're not having to euthanize these animals. but also people can be a barrier. There's a lot of people you have to get on board in creating change. Time, clear advantage. You have to spend way less time when you're doing environmental health monitoring versus soil bedding sentinels. And I just want to highlight this data from University of Chicago. They're actually saving 1.5 hours per week per 10,000 cages, which really adds up. Staffing is really challenging in the field right now. So doing those time studies can be really important. And then the other thing to emphasize is that we actually found 30% of our respondents said there are no barriers. We're doing this, it's easy, we can do it well. And so again, that's really encouraging. The other thing is we actually found that 96% of institutions said they would accept rodents from other institutions that use environmental health monitoring. Some might want additional testing, but some of them want additional testing no matter what. So this again is a barrier that, you know, is a perception, but it isn't really reality. What about our quantitative data? Well, excitingly, the theory of planned behavior still holds true in terms of environmental health monitoring. Very, very strong significance here where people that do have more positive attitudes, do have more positive subjective norms, and do have more behavioral control, so more self-efficacy, are going to intend to do this more. And this really shows us, this is just another example that when we're thinking about creating 3Rs change, we cannot focus only on just rote giving information, just conducting studies. We need to systematically think about how do we change people's attitudes? How do we show social proof so that we can show that there's professional pressure to use this? And how can we help people do it? How can we increase self-efficacy, make it as easy as possible? And that's really what we do here at the 3Rs Collaborative. And interestingly, nothing else mattered. You know, again, you'd think, well, these people have easier racks, they would do it more. Not the case. Or maybe there's a certain country, or maybe again, it's the academics or the pharmaceutical companies. Nope. And it's not even accurate knowledge. People don't actually need to know that accurately about the technique. They just need to believe that it's good. They need to believe that it's worthwhile. They need to believe that it's the right thing to do, that other people want them to do it, and that they can. And if they believe those things, they don't actually need to know all the nitty-gritties of the evidence or how many publications or, you know, X, Y, and Z. The attitudes, norms, self-efficacy are more important. But really our takeaway is that we're really seeing the needle change, which is great, but that doesn't mean our work is done. We do see, though, that it's practical. So we know of at least, I think actually this number as of today is up to 18 large facilities that have made the switch, including ones that are very complex, you know, industry, global companies that have multiple sites, lots of different rack types, caging types, they can do it. They don't find issues with exports, and they say they'd never go back. So hopefully I've convinced you that you should be switching to environmental health monitoring if you aren't already. So how do you actually do that, and what's out there to help you? Because again, just because you're convinced to do it doesn't mean it's an easy or a fast change. So first, figure out what types of cages you have. If you have IBCs that filter at the rack level, again, Allentown Technoplast, you can use exhaust dust testing. You don't have to, but you can. And often that's going to save a little bit more time in terms of your technicians. They don't have to transfer that dirty bedding. But some institutions decide to just do Sentinel free soil bedding. It's a little less cost intensive initially, and then they can have it the same for all their cages. So that's fine too. So again, this is just a few pictures of what it actually looks like. These are the collar mounted media up top and swabbing the plenums down low. Very similar to soil bedding sentinels. You either put the media in place or you just don't wash the racks for 3 months. You swab or you take the media out, and then you send it to your diagnostic company for PCR analyses. And we do, you know, we work with the diagnostic companies as well. They're well versed in it. They're really some of the experts in this as well. So we encourage you to look at them. On the flip side, Sentinel free soil bedding, this can be done with everything. And again, you either have that same cage on the same rack where you're adding soil bedding to, or you have a bin just in the room somewhere that you're adding bedding to. And then you either have a media, whether it's filter paper or a swab that you just leave in there, you stir it, you shake it, or you do that just at the end. There's a couple different ways to do this. So far, there hasn't been really strong evidence that this type is way better than this type. So you really just have to decide what's right for you, and hopefully we'll see more of those side-by-side studies coming out soon. So I've mentioned this. If you scan this QR code, it'll take you to our website. We have a huge resource hub that I'm going to walk you through on all of our resources. So this is our website. If you go to Replace Health Monitoring, we have this really big resource hub. On the first page, we talk about why do you change? We give the logos and the names of all the institutions that we know of that have switched. We briefly say how to do it, describe the different methods, have links to our SOPs. We also have presentations. So if somebody at your institution wasn't able to make it today, you can send them PDFs from our prior ones. You can watch others that we've done on this topic. We also have a list of all the peer-reviewed publications that are relevant. There's more in here than our systematic review because there's some just on soil bedding sentinels. We also have an editable slide deck that you can download and present internally to convince people. We have SOPs that you can download and edit. We have guidance for how to conduct your own cost analyses, as well as example cost analyses, and an Excel setup to make it a little bit easier. We also have information on sanitation. So, why is sanitation important? What do you have to do? We've got a few references on that. We've got call for research projects. Again, more research could be done. It could be beneficial. And then we also have answers to frequently asked questions. So we've really tried to do all the work to make this as easy for institutions as possible. And, excitingly, it's making a difference. We know that at least 8 institutions have changed, replacing 8,000 rodents each year based on our work. We're very proud of that. So this is just more pictures of our resources. This is a picture of our SOP, our Excel. And generally, how do you switch? Referencing our website, figuring out what method's right for you, reaching out to your diagnostic vendors to kind of see what they recommend, have an internal advocacy group and create a plan. Again, there's different ways to switch. You can, do it gradually. You can do a hybrid approach. You can just stop it all at once. There are supplies to get. There are SOPs that you need to write for your institutions. You need to communicate to everybody involved. And we actually did some presentations, really some kind of case studies on how to change, what you can do. And those are on our website. The KLAS one will be coming up soon. Again, this is a list of logos of institutions that have changed. We know that we are making a difference in that, and this is where the field, it really seems to be going. What's next for us? We're working on our systematic review. We're going to be adding citations to our SOPs. We're going to be adding a resource page on how to switch in more depth, like what the process should be. We're going to be looking at our year 3 benchmarking survey and figuring out if we need future years. And we have been accepted for a 2023 roundtable at ALAS, really focused on, again, the Sentinel free soil bedding and new evidence and implementation. Ultimately, though, the takeaway that I hope you get from this talk is that environmental health monitoring is advantageous. It's good for the 3 Rs. It replaces Sentinel rodents. It's good for science. It works better than soil bedding sentinels to detect pathogens. It's good for operations. It reduces labor and cost. And it's good for staff. It can reduce emotional fatigue from those euthanasias. Lots of acknowledgements to get out. Again, I've learned so much about this topic in the last couple of years. I couldn't do it without my rodent health monitoring initiative. I want to thank all our current sponsors. They really make this work possible. We don't receive government funding at this point, although we would love to. So if you don't see your institutional logo on here, encourage your institution to become a member. And then the last thing, while I see if there might be a minute or two for questions, is to really sign up for our newsletter. I email a couple times a month, really high level targeted casual emails that have resources. And this is really the best way to get the latest from our group focused on promoting implementation. Thank you.
Thank you, Megan. I also have to thank Megan for half doing the introduction for Liz Nonamaker for our next speaker as well. Though I'm gonna go ahead and repeat. So we are, of course, out of time for questions, but if you have questions, if you could put them in the chat or in the Q&A box, Megan will be able to see those and answer them.